Welcome back, dear viewers. You're still watching Nile Cruise on Nile TV. And of course, as we all know, one of the main issues that we are really indulged in nowadays, though the entire world is really indulged in, is of course the coronavirus pandemic, which of course our life and the life of our children and the life of our brothers and sisters and families and our citizens are all related to nowadays. And of course, our community has an urgent need to raise the awareness related to the pandemic. There are many current initiatives, either public or individual, to prevent any misinformation circulating across different social media that exist in the world today regarding our health challenges, especially when it comes to the coronavirus pandemic. And dear viewers, in this context, we have with us two wonderful guests today to discuss more about this. We have with us Dr. Magdi Adli. A very good day, sir, to have you with us.
Good morning.
And he is a master degree in hospitality management and infection control and a responsible member in الدنيا Group for medical consulting. We also have with us, and it's a pleasure to have you with us, Dr. Amani
Hello.
Musa, a pharmacist and a management consultant, hospital management diploma, and an admin of الدنيا Group as well. A very good day, dear guests, and it's a pleasure to
Welcome
have
to
you
you.
with us in
Welcome
today's
with you.
episode of Nile Cruise.
Thank you.
Dr. Magdi, Dr. Amani, thank you for joining us. And of course, Egypt has succeeded in dealing with the COVID-19 pandemic, thank God, and a great success. And part of this success was the fact that awareness had been raised. And part of the success is not only the effort of the government, but also the effort of, and not only of the people, but also of the group of volunteers, the volunteer doctors, the volunteer pharmacists from different institutions and governorates that worked hand in hand with the government and with the people to raise awareness to protect our community. Dr. Magdi Adli, tell us about your group, الدنيا Group.
First of all, I'm appreciate to be with you this morning, and thank you for that invitation. So we start from the idea of the group. That idea of the group is starting even before coronavirus epidemic. Dr. Amani and some helpers, Mr. Mohsen, having the idea to start for spread the right medical concept and to recorrect the medical concept in the community, because sometimes, you know, in social communication there is a wrong medical concept, and we'd like to recorrect that medical concept and aware the people about the medicine and drug interactions, and when they can use this medicine and when they can't use this medicine. That was before coronavirus, and then from the emanated or the special the social responsibility towards the community. We think about to collect doctors from many specialties to the group, so that anyone who, especially people who are enabled people, they can connect through the page of the group to these doctors and send their medical examination. Then we send it to these doctors, and we have a pleasure to collect like 1,170 doctors of different specialties and of high degree of consulting. They are welcome for that idea, and they helped us very much in to do our job. And our job is clarified in the time of corona virus epidemic. because you know there was a quarantine and there was some people can't go to the clinics and hospitals, and they need some people or some doctors to help them in their self quarantine, so that they send us their X-rays and lab test, and we send it to the doctors. They respond on their WhatsApp or through the group page, and we send the answers to these people.
Great,
Okay,
very
sir,
clear.
that's a wonderful, of course,
Yeah, of course,
initiative, and
great work.
a
Yeah.
great work. Dr. I mean, you want to say something? And we move on now to Dr. Amani Musa. Dr. Amani Musa, very good day, and it's a pleasure to have you with us.
Welcome.
Of course, Dr. Amani, you're a pharmacist, you're a management consultant, hospital management diploma, and on top of all, you're the admin of Dunya Group. And it's very important here, as you're the admin of Dunya Group, to know more about the group and the role of the group and your role in the group, please.
First, hello and welcome to you. First, I would to see the group was created last year. I am the admin of group and responsible for management with cooperation with Mr. Mohsen Abdullah and Dr. Ahmed Al Warre.
A very good day.
The first aim of the group is social solidarity to help people whose material condition don't allow and they don't have any price for medical examinations and for buy their medicine for treatment. Second aim, I want to spread awareness in among people. People with chronic disease who need periodic follow-up for this disease and follow-up for their drug use. We try to learn them how to use their medicine, how to learn their side effect, and the effect of some food on their medicine that may delay their recovery from this disease. The group informed us a lot during coronavirus because it is very difficult to get out of the house and go to hospital or doctor. We follow up many cases in houses by viewing their life history and analysis and their CT cut on the chest. According to the protocol of Ministry Health and World Health Organization, we amazing good result and we achieve a success in this point.
It's great to hear, and we commend your efforts, really, Dr. Amani and Dr. Magdi. So we understand that you had started, Dr. Magdi, even before the coronavirus pandemic.
That's right.
So that means that lucky for the patients who dealt with you, because it was time indeed.
Yes.
It was difficult for people to go to the hospitals, to go to the street.
Yes.
So it was easy to contact
we
you.
We made great effort in this period. We can't sleep for 2 or 3 consecutive days to follow simple and moderate case, and we direct severe and critical cases to hospital.
We
How
commend
did you,
your
sir
efforts.
Mohammed,
Great. Yeah,
sir
we respect
Mohammed,
that. We
How,
respect
For-
that.
Doctor, how,
for
how
our
did you
luck.
get the idea, Dr. Magdi, of the entire Dunya group, and how did when did it start exactly?
It start, I think,
And the idea. How did
the
it come up?
idea, the idea is starting by Mr. Mohsen. He is a great man, by the way. He is the owner of the idea, and he introduced it to Dr. Amani, and then Dr. Amani collect the responsible for the group. And for our good luck that we start before coronavirus epidemic, then I think it's the creation time was by 2019, and now we have I think like 24,000 follow-up for the group. By the way, it's not from only inside. We have followers from outside Egypt, and that was a great for because of these people who are Egyptians are working outside in Arab countries. Even they are following us and connect with us through epidemic, because there is no connection or there is no transportation
Yeah,
this period of time.
yeah.
So they was connecting with us to ask how they can deal if they have coronavirus, and we answered them through WhatsApp or through the page of the group, and even we have little videos we make it for to aware the people about what they can take of medicine, what they can do if they have COVID-19.
Indeed, that's
Mhm.
really great. And Rana, it's clear that it's not only about how to deal with COVID-19. Uh, it's about raising awareness, as we understand, Dr. Ameni, in general, raising medical awareness, leading or guiding people to a healthy lifestyle. You want to make the patients themselves know more about their problems and how to deal with them, right?
We try to spreading awareness among people, especially during coronavirus and the pain, especially in this period. It is very difficult to get out the houses and go to doctor. We follow up many cases, but I speak now on simple and moderate cases only. According to the protocol in this time, protocol of treatment, we see viewing analysis and CT cut and history of patient. We follow the medication used by the patient and any side effect will appear in this period. Many doctors joined us to the group, and they with love need to help people of our especially unable people who can't have a price for treatment or go to medicine. We achieve amazing result in this period, and very cases were cured from coronavirus.
Mr. Magdi, do you plan on moving on to other Arab countries, not only here in
Yes,
Egypt, but go on to Arab countries and
as
move
I
on with
told.
your initiative?
Uh-huh.
You mentioned in your
Yes,
that
yes.
it is not only
Mhm.
strictly on Egypt, and that other countries
Yes.
or
Let
indulge
let
in
let
other people.
let me let me tell you something very important, that every day there is Arab people from other nationalities send an order to be added to the group, and this is indicate how we succeed in our job.
You
Uh,
give the advices in Arabic or in Arabic and English? In
even
both,
both,
both languages. Yeah,
according
because
to
some
the
of the medicine
nationality.
and some of,
Yes,
yeah,
according
they
to the
have the English
nationality
names.
of
Yeah,
of
yeah. Mm.
Both language,
the
oh,
staff.
So your
both
scope,
language.
Dr. Mani, is not only strictly on Arab countries, but you go on
Inside
beyond
and outside
internationally
Egypt
Yes,
for
during this
international
period.
countries as well, not only Arab.
Yes, inside and
Other
out.
countries like which countries?
Arab countries and foreign countries.
Foreign
foreign
countries
countries,
like
All Arab countries
uh-huh,
joined the group.
all Arab
or
countries. What?
Arab citizens, but they are staying or
And they always
on Europe countries or
Yeah.
in other
they always send
uh,
congratulations for the group.
yes.
Of course, I just want to make 100% sure of this. This is for free, right? This is
Yes,
volunteer work.
this is
Nobody
the
pays a single penny.
For
nobody
Just want to
free,
make
For
sure.
free for
especially for
people.
unable patient.
basically we make that group for enabled people.
Our aim is social solidarity.
Yes,
For the poor people.
Oh,
Okay,
and
yes.
Dr. Amini, how did the doctors were willingly to help you when you started this initiative and when you decided to do this group? The doctors, were they very helpful, or were they hesitant to come and join the group, or they just came directly and volunteered? How was the reactions of the doctors?
Many doctors and professors joined us in different specialists. They need to help people with love. They present a good medical consultation in the group after viewing patient history and medical examinations. And they write the drug useful for this case. This is for simple and moderate case only. But critical and severe case, we direct them to doctor clinics for free without any cost. Or some patient asked to direct to intensive care unit. We direct them to the hospital with coordination with hospital manager.
Great, great. You
Not
wanted
only-
to say something, Dr. Magdi?
I'd like to add something to what Dr. Amani said, that there is many or a lot of doctors or professors in Egypt. They'd like to do an volunteer work, but they don't know how the channel through where. But they would like to do a volunteer work. So when we introduced the idea for them, by the way, they were welcoming for the idea very very well. And by the way, some of them was having a high responsibility in the Ministry of Health before, and they help us actually in for even treatment of the case, or if the case need to introduce to the hospital or ICU, they help us.
And Dr. Amani even said that
yes,
you
so
in the group,
not only
you help the patients even contact or get a link
We
with
follow up
the
patient for
hospitals.
months. We follow up chronic disease for
Perfect.
months.
Dr.
Even
Magdi,
we follow the case after
Perfect.
taking the treatment, and the case usually be contact with us to tell us about
The outcome and
yes,
rehabilitation. Perfect.
Dr. Magdi, how is the cooperation between you, your group الدنيا, and your initiative, and the doctors that are outside Egypt, not the doctors inside
yes,
Egypt? How do they cooperate with?
that is the great point of the issue, because we have doctors and professors not they not stay even in Egypt, they stay outside Egypt, so they can help us through the technology, which is internet and WhatsApp and so on. Through the internet, and they help us through the technology. Even they don't stay in Egypt, they are outside Egypt, but they would like to do a volunteer work. We just, Dr. Amani sent the case and if they need examination or something like that, sent through
Email?
yes, through mail, and the answer or reply of the doctor is coming, so that we connect the doctor, make connection between the doctor and the case through the group.
Well, this is
Dr.
great
Amani, what do you want to
volunteer
say
work,
about
yeah.
this? Do you want to say?
Many cases live in other countries. They send us their medical report. And
This is the cases. You're not discussing the doctors.
cases.
You're not continuing what Dr. Magdi was saying.
By cooperation with Dr. Magdi, cases send us their medical report, and we viewing first and decide if we write the medication and give medical construction, or direct them to hospital or doctor clinic.
Okay, Dr. Amani and Dr. Magdi, we want to benefit from your presence with us here. And we want our viewers, our Nile TV international viewers, to benefit from you. And I want to ask two questions to both of you. It's the same. I mean, I want to,
He wants each of them to answer. Each of them
both,
to
yeah,
answer.
both questions.
He's gonna ask you
yeah.
two questions, and
Yes.
you want two answers from them.
Yes.
Each of them.
Yes. First, Dr. Amani, the advice you give to the people now as we are entering autumn and then winter, and there is fear, maybe, potentially, in the world of a second wave
Wave.
of COVID-19 pandemic. There is the fear. We don't say it's going to happen. So
No,
the
Muhammad,
advice.
I think to my knowledge it's happening.
Okay, مش
And to my
مشكلة.
knowledge, I'm not sure.
Yeah.
So,
So
Dr.
let
Magdi,
me
you
an-
tell
the
us
let
more.
me
advice,
answer
advice.
that.
Yes,
Let
the
me answer
advice.
that.
What people should do now? The students who are going to go to school.
Yes.
Yeah, that's the first question. The second question, the misconceptions. I'm sure that there are a lot of misconceptions
Yes.
that we ordinary people,
We don't know
we're
about.
not the doctors, that we are confused with. We get wrong,
Yes,
ideas. So
yes.
tell us about the most important misconceptions.
First of all, we can talk about the panic
Advice? Yeah.
or advice for people because of we are on autumn is coming, so that we advise people to be careful because in autumn the viruses as a general spread of virus is the high in this period of time exactly. And by the way, I think COVID-19 is a start last year in that period of time. Some cases tell us through the group that COVID-19, the symptoms of COVID-19 start with them from October 2019, not even November. So we are advising the people to be very careful and to apply the precautional measurement and social distance as possible and wearing a mask. By the way, I'd like to say something because some people they said that we can't wear a mask because we don't have
have
enough
trouble
oxygen.
breathing and stuff,
Yes,
yeah.
even in a crowded area. Face mask, by the way, doesn't affect the oxygen in the blood. So that there is no fear about to wear a mask. We need only to, and when you wear a mask,
You've answered the misconception
yes,
part as well there.
yes,
Yeah, okay.
and when you wear a mask, by the way, you don't even protect yourself. You are
protect the
protecting
others.
others.
Yeah.
So
So you're showing respect for the others when you wear the
yes,
mask.
that's what we would like to say. You're supposed to respect others, and others supposed to respect you.
Beautifully said, Dr. Magdi.
Yes.
We want to hear from you, Dr. Amani, the advice and
Uh,
the misconceptions.
First, I like to say follow the medical construction of Ministry of Health. Follow الدنيا group in the next period. There is a big surprise to face coronavirus.
You're
Okay.
preparing for us good advices, good tips in the group.
Dr.
Good. Good.
Magdi, from your own point of view, are we on the verge of a new wave, or we
Uh,
started actually a new wave, or what
look,
do you
we-
foresee?
Or can we avoid a new
Yes.
wave?
For second wave, by the way, nobody can say there is a second wave because a second wave you can say there is a second wave if you have a first wave and then zero detected cases. But right now, every day we have infected
New
cases,
cases, yeah.
but low number of infected cases. And by the way, there is a good news, and I think some people
vaccine?
know that. Yes, there is a report said the last report says that we have the number of 131 record for the infected cases
All over the world, you
all
mean?
over the world, and we have the number of 123 of the recovered cases.
Yeah, Alhamdulillah, Egypt's numbers are
yes,
good.
there is.
Yeah.
Okay, sir, I want to ask you one final question before we wrap up today's episode with you. Thank you.
Thank you.
Sir, what is the reason behind, of course, Egypt as a government is taking wonderful precautionary measures and the people,
Very
the
true.
citizens
Very
are
First,
going
yes.
after under the directives of President Abdel Fattah al-Sisi, of
Yes,
course.
this is
It's
right.
worth to mention because it's worth all respect. But what is the reason behind that that the cases in Egypt, although, for example, in the North Coast, everyone was going around without mask, there was no social distancing,
Yes.
although there was something from God that
Yes.
was keeping us
And
safe,
that-
all of
The
us.
weather,
Yes.
maybe.
And that's what we fear about.
Is it the Quran when it says "ودخلوا مصر آمنين"?
No, no, no. This is there is no relationship between religion and what happened for COVID-19. Egypt, as a weather, is a nice weather for not for spreading viruses. Europe, you know, the temperature is low and humidity is low, and this is a good environment for spreading of
That's
virus.
why we even have medical tourism.
Yes,
I mean, part of
yes,
our
this is
tourism
good,
here in
yes.
Egypt. Yes.
And but we
Our sun, our
but
sand.
I'd like to say something very important. By the way, Mr. President Fattah Sisi, from the beginning of pandemic, we are a country of 25 countries who have the precautionary measurements, and we take our plans for that COVID-19, and we succeed to contain that virus. By the way,
Thank God. Thank God. Unfortunately, dear viewers, that's all for this segment of the this episode of the Nile Cruise. We thank very much our dear guests here, and we commend and respect their work. Dr. Amani Musa, pharmacist, management consultant, hospital management diploma, and admin of الدنيا Group. Thank you very much.
Thank you.
Again, all respects, and we recommend your efforts in volunteer work to help the poor, to help raise awareness. And we thank you also very much, Dr. Magdi Adli, Master Degree in Hospitality Management and Infection Control, responsible member in الدنيا Group for medical consulting. Many respects, sir. Thank you very much.
Thank you very much. Thank you very much for joining us. Dear viewers, stay with us. We'll be back with another segment. Don't go away.